Red dots, red bumps, blisters, and sores. What to make of a child's rash? Parents come to the office every day asking what caused my child's rash. Well, first of all, a rash is simply a change of appearance of the skin. Many reasons cause this. It could be a viral infection, an allergic reaction, and even bacterial infections. Let's discuss 4 common rashes that pediatricians see every day. One viral rash that we occasionally see in the office is hand, foot, mouth disease. This is a virus that is associated with fever and is somewhat contagious. It's not a very serious virus infection, but it does worry parents because of the name. The lesions, as the name implies, occur in the palms, the soles, and inside the mouth. Occasionally, in a young child, you will see the rash in the diaper area as well. The main worry about hand, foot, mouth is that the lesions in the mouth may make it difficult for a child to drink adequately and therefore not get enough hydration. Chickenpox, also known as varicella, is seen less frequently these days since the introduction of the varicella vaccine years ago. Chickenpox, as a virus, causes a number of reactions, including a rash that is unique in that it starts on the chest and the back and it spreads out to the arms and legs. The rash of chickenpox has red dots, red bumps, and clear water blisters. Without the clear water blister, called the vesicle, the diagnosis of chickenpox is hard to entertain. The treatment of chickenpox depends on a number of factors. If there's fever, treat with Tylenol or Motrin, not aspirin. And if there's itch, which there almost always is, using oral Benadryl, diphenhydramine, and topical agents such as calamine lotion. Of great interest, a cold compress really will fool the brain into thinking that there is no itch present. I use it all the time and it works, especially on things like chickenpox and poison ivy. Fifth disease, known as erythema infectiosum to doctors, is a common reaction that we see that presents with the appearance of slapped cheeks. They are literally red like sunburn, and then the development of a lacy rash, usually on the upper part of the arms and upper part of the legs. Once the rash of fifth disease occurs, you're no longer contagious and may return to school. The treatment of fifth disease is symptomatic. If there's any fever, treat with Tylenol. But once the rash of fifth disease occurs, you're no longer contagious and may return to school. A child with sickle cell disease or a pregnant woman may have serious complications, and if a woman thinks she has been exposed to fifth disease, she should seek medical attention from her gynecologist. Hives, which physicians call urticaria, are a type of an allergic reaction that presents with large, swelling water blisters. The cause of hives is frequently not known. It could be a stinging insect, a food, a medication, or even an inhaled pollen. Most hives are caused by the release of histamine. That's why we use antihistamines like diphenhydramine, which you know as Benadryl, to reverse the reaction. Occasionally a hive presentation will be with respiratory distress and immediate medical attention should be sought. Unfortunately, the cause of hives is frequently never found, which is frustrating to both parents and doctor. The treatment of a child who has hives with Benadryl may give temporary relief. This relief may last for a day and the hives may come back. Hives may be acute, subacute, or chronic, meaning they'll last a long time. If you're treating hives, use the Benadryl, use a cool compress, and use a topical anti-inflammatory such as hydrocortisone. If hives persist, or if there's trouble breathing, you should seek medical attention. Parents oftentimes want to know, why is it called fifth disease? Well, it was the fifth rash determined in young children in the early 1900s.